All right, hello there. My name is Chris. I'm going to do a quick presentation on rabies. So rabies is a zoonosis virus that is spread through the contact of mammals or bites from animals to humans, and those rabid animals can include the dogs, bats, and raccoons, and even more. The characteristics of the rabies lyssavirus is that it has a negative single-stranded RNA and it has a helical capsid, being a member of the Rhabdoviridae family, as you can see to the right diagram. You have a spiral shaped nuclear protein. It has an envelope as well and has glycoproteins that are used for attachment. So these attach when it enters the body. However, it enters the body through bites and contacts with open breaks in the skin. Because the virus is primarily in the salivary glands and the saliva of the rabid animals, biting is perfect for the virus to spread, where it targets deeper tissues until it hits the skeletal muscles. In the skeletal muscle, cytoplasm is where the replication occurs, and it travels into the neurons and attacks the central nervous system once it is incubated and strong enough to do so. So once it hits the central nervous system, it degrades the spinal cord and brain functions. With that, some symptoms that are included with that is fever, itching, and pain from the contact area, usually from the bite, and anorexia. Those are immediate symptoms. And as you progress, you get hyperaggressive behavior, hydrophobia due to the dysphagia or like unable, painful, difficult swallowing of water. And as you progress even farther, you get seizures, hallucinations, and disorientations, as you can expect, due to the degradation of the brain, and ultimately leading to paralysis and death from respiratory paralysis and other complications. Enough of the bad things. You get to the prevalence of the cases of rabies, which has been decreasing significantly for years. Only 25 cases have been reported between 2009 and 2018. And as you can see, a lot of these cases are from people who have been traveling to different countries. So people who live in rural areas and less developed countries are most at risk for contracting rabies due to these areas having a plethora of stray dogs and wild animals like badgers, foxes, bats, and skunks. And 90% of rabies cases actually do come from bats and dogs, as they are the primary vectors of this virus. So through the diagnosis, treatment, and prevention, when you or upon observation, the symptoms and are used to diagnose for the rabies virus, and as well as testing for the antibodies to confirm using the brain tissues or skin and saliva specimens. After death, however, serum tests including immunofluorescence uh, tests identifying the negative bodies just to confirm that they do indeed have the rabies virus. Immediate symptoms can appear, but within 10 days, usually 2 to 10 days is the usual case. However, incubation can last up to 12 years. However, when symptoms that are severe do arise, it may be too late to treat the patient. So it is best to report immediately, and the treatment goes as follows. Extensive washing of the affected area, a potent vaccination, and rabies immunoglobulin to boost the immune response. So this can all be prevented using the human rabies vaccine or the human diploid cell vaccine. Upon the first exposure, however, you do want to get the vaccine right away, and as well as the 3rd, 7th, and 14th day after the first exposure. And it does take months to have a full recovery, and the patients do experience multiple symptoms of the virus as well. Domestic animals and animal handlers, such as veterinarians, need to be vaccinated, maybe even yearly, as well as the travelers that are traveling to foreign countries, due to the chances of encountering a rabid animal. So it is best to have a vaccine before travel. One way to also prevent is the administration of the vaccine to wild animals. However, that is extremely unlikely due to the rapid spread of the virus in the wild. So that is it for rabies, and thank you very much for your time. And I hope you have a wonderful day. Thank you.